So remember we talked about foodborne diseases, and today I'm going to talk about one of the most important infectious disease, and that happens to be cholera. And again, is a waterborne disease. So as you are aware that there are quite a few places in the world where we have unclean water. And on top of that, if there's poverty, overcrowding, so some of the diseases flourish. And there are some other reasons as well. So I'm going to pick up one prototype, which is cholera, and I may have shown you this picture before as well from the National Library of Medicine. And the WHO center is in Bangladesh, where there are 120,000 patients a year. Now, a part of it is to play in terms of overcrowding, as the statistics are there are 135 million people in a country of size of a New York State. So you can imagine what's happening in terms of availability of clean water, and more than 9 million in Dhaka alone. This is a award-winning picture that shows, if you remember, does anybody remember which was the bacteria I showed in reference with? Huh? Titanic. You're talking about Titanic, right? Movie? Clostridium tetani. Okay. That's close. You're not that far. So again, if you pay attention, maybe you have a better close-up on your computers. I've posted this morning as a PDF. A typical shock. So you can see shock, heals, and pallor as one of the important aspects of this disease. And again, this is from a big epidemic we have in 1970. So you can see from here, very important. And many of these diseases are waterborne. There are no toilet facilities. And we're going to talk about some of the health-related aspect of some of the diseases as cholera today. So you can see the face over here, shock, pallor, and heals over here, and of course, unconscious. Now, if you look at the world picture, it's not that vibrio is only there in that particular part of the world, but you can see that there are incidences all over the world. Some of the places, like you can see from India, Bangladesh, Far East, Africa, and even Eastern United States does have a rate of vibrio cholera. Not, shouldn't say vibrio cholera, but vibrio. So cholera is a notifiable disease, and there are different types of vibrio, and it's there in water. Now, historically, a lot of theories for that. We are still struggling with that. That will give you another important aspect of some of the diseases that we think of. So you can see from here that they're talking about 90s or early 90s, that probably the first case was demonstrated somewhere again in Bangladesh, or I would say Eastern Bengal. And then again, as the people were traveling, so travelers used to take these bugs from one place to another. If you're interested, you can even Google, and these are like what you call conspiracy theories as well, that what's his name? Columbus was the first one to bring syphilis to this part of the world. But anyway, so there are always some kind of historical perspectives over here. But you can see it's been documented that people traveling by sea were there to bring cholera to European countries. So they kind of tracked the route for it. But the interesting part is that some of the studies are saying that probably cholera bacteria, vibrio cholera, exists over here in the mountainous area which are near to Himalayas. And when there is high rain, monsoon and other, that brings that bacteria up into the water. So that's something that they are exploring and finding out what is the origin of bacteria, what's the normal habitat of bacteria, and how it kind of plays back and forth. So things are not pretty simple. If we talk of a particular area where there's a high incidence of a disease, there are always ecological reasons for that. So this bacteria particularly is important in terms of us knowing that it originated from this part of the world and spread across European countries by the travel route and the travelers going in that area. Now, if you go and look at historical perspectives, you can imagine we didn't know the cause of it. We didn't know there were no antibiotics at the time. And people were not paying attention to what is the actual pathogenesis. As we'll discuss today, that each group of people, from male, female, whole families kind of were involved. So nobody can take care of each other, like mom, dad, kids. So that was a horrible picture, even in historical times. And cholera and history, if you Google it, you'll find that there are quite a few pictures available, and that tells you our condition of how we deal with an infectious agent without knowing the cause for it. And even in this part of the world, again, when the epidemic breaks, and remember, it's not like 1 or 2%, so it's like cities and thousands of people. And even if you were to give them an IV line, for example, to replace the fluid loss, we are not prepared for that. That's, again, we'll talk about that in detail when we talk of influenza. But historically, infectious diseases, as you can see from here, there was a big challenge that we ran out of places in the hospital, even in the best of all the facilities. There was one movie, I don't know whether you guys are interested in that. So this is some of my electives, especially for infectious diseases, teach you something in perspective of a happening. So this particular movie is also been linked with the cholera, especially, imagine 1817 to 1823, and there's an epidemic going on in the world, and all over the world people are dying with it. And there are quite a few historians, especially, I don't know whether you know this particular person. I actually don't give his name as well. I should have. So he's like an award-winning author. He talks about the misery of people at that time and what was going on. And in some of the electives, infectious diseases, instead of telling you how to get prepared for that, we give you a perspective as to what was the life of the people and how did things go. It happens to be a part of a romantic story, but it does give you a picture of people dying of that, and people know what to do, and all these kind of things, especially happening to, let's say, people fighting a war, people there, they say the British Army, many things were happening at the same time because it was waterborne disease. Okay? All right. Now, you can see from here is a typical picture that we tell. If you were to look, hopefully you're not going to look at this picture in this part of the world, but if you go into the rest of the world, you see when there's an epidemic in Asia or Africa, so they make temporary hospitals. So what they do is they make like a bed like this one, and again, there's a hole over there because the person has diarrhea, uncontrolled diarrhea. And the patient is so weak that you cannot allow him to go back and forth to the washroom. So we provide that. It also gives you a picture about the spread of the vibrio. It's also a picture of people who are going to take care of them. So water, which is a natural environment, and again, you'll see in ecology, water, patient, diarrhea, and how do we deal with that? And in this case, you can imagine that an infected person can excrete up to 40 pints of fluid. So 40 pints of fluids containing 20 billion bacteria. So you can see everything's out of control. So it becomes totally out of control. And what we need to do, the best treatment in this case is that we have to give an IV. Okay? Are the backbenchers with me or preparing for the exam tomorrow with the laptops open? Honestly. I'll say truth, nothing but the truth, whatever. Okay, anyway, that's fine. All right, so you can see this is a typical scenario. This is a ward. This is a hospital ward. If temporary ward, any part of the world, if you were to go and offer yourself, and there's a big hole over here, a bucket underneath, and then you just have to lay the patients on top of that and make sure that you secure an IV line. So that's kind of a problem that we are dealing with when an epidemic breaks up, especially cholera. Again, the important thing is that it is a burden not only for the person, it's also burden on the health authorities. This particular case, again, is in Asia, but you can see from here that this particular disease, when you lose the fluid, if you know a little bit of physiology of that, if you lose the fluid loss, what will happen is even natural fluid loss, you will have renal failure, pulmonary edema, and if it's a pregnant woman, she's going to abort it, and profound hypoglycemia, and especially in young children, you got seizures because you have hypokalemia. So this is a typical picture of a shock in cholera. And that's one of the common questions asked, what are the complications of cholera? Okay, and then again, if you don't replace that within hours, you will lose the patient. So that's important in terms of, so once the epidemic breaks, so the public health authorities have to make sure that you prepare this ahead of time and right from the word go, be prepared for that. There was a good article, I think many years ago, they were talking about a typical country like Congo and Zimbabwe. So you can imagine the plight of those people. For them, if, God forbid, cholera breaks, is even worse than a time bomb. So because if you know the country, if you've been over there, then you pretty much will see what is happening in terms of especially children, women, and emancipated or very weak people in terms of when a cholera breaks out. So you call 911 and the ambulance comes. So this is an ambulance over here. You can see from here. I don't know if they have 911, but you can see far off villages, the guy, if he himself doesn't have a cholera, he's going to put all his family there and bring them to the hospital because he's not going to secure IV line. So these are practical problems. And again, it happens to be the polyclinic. So, is a call in for the polyclinic. If he goes to the hospital, this is what the hospital looks like. So you can imagine all age group people are there. But one thing you would notice is that unfortunately, nothing they can do about that other than secure an IV line, which is not that easy, especially if you are already in hypovolemia. Your veins get collapsed. But this is how it looks like in terms of the conditions, and again, as I said, WHO and CDC and all these places need to kind of move in. Again, another country with a same picture, pretty much the same, maybe there's an ICU ward, you will see the same thing over here, IV line with a big hole over there. And again, don't think that these people will have any air conditioning over there or any of other facilities for their sake. So vibrio cholera, the organism for today is important in terms of public safety, in terms of waterborne diseases, and in terms of a toll that it takes on the life of people all over the world. It looks something like a curved rod, as you can see from here. And it does has a flagella, so you can see a flagella over here. And Vibrio as a larger family, like a genus, is composed of 76 species. And luckily, there are only 3 which are considered as human pathogens. Of course, top of the list is Vibrio cholerae, and we have Parahemolyticus, and vulnificus. So these are the three important vibrios that we deal with in our clinical practice. So let's talk about vibrio cholerae. Again, gram-negative rods, curved, fermentative. They are facultatively anaerobic, and they require salt for growth. What does that signify? If they require salt for growth, what does it signify?
Acidophile.
Acidophile, salt. Huh?
You love bacteriology.
Say it again?
No.
Well, what I'm trying to tell you is the bacteria needs to divide. It's going to take your salt. You'll be depleted of the salts and electrolytes. That's a problem. So you have to replace the salt because bacteria is consuming the salt. That's what I'm trying. That's what the pathogenesis is. And then again, there are many different serotypes. The most important cell wall antigen is O cell wall antigen, right? Now, in this case, like we talked about toxins, this is again a AB toxin. So there's a cholera toxin. And again, I would want you to make a list of all these toxins, whether it be Corynebacterium, whether it be Clostridium. Make a list of toxins. They all are different. So most of the questions that you will see in the toxin will relate to all of them at one time. So you better make a list of especially the AB toxin. But the most important thing in this particular bacteria is that the toxin and also a co-regulated pilus. So that's important. I'm going to talk about that in a second. And infection can range from asymptomatic colonization. So you may be carrying it and don't have the disease to a person having rapidly developing diarrhea. So this is one of the cases you get infected and you get rapidly diarrhea. So you don't even have time. So you have to replace the fluids ASAP, otherwise it's going to be very fatal. So this is one of the diarrheal diseases. As I said, the WHO headquarters for diarrheal disease in Bangladesh because there's a very high incidence over there. Now, if you look at the micrograph, you will see that it has a typical short rod with a single polar flagellum. So it's a very long flagellum. So that will tell you because it can easily swim in the water because it is there in the water and the stools. Same picture, again, you can see these electron micrographs are just telling you the size of the tail, the flagellum. So to allow the movement, some of the bacteria are mortal. One of the common questions asked is that which of the following bacteria are non-mortal? Which are the bacteria which are mortal? So these are again one of the groups that you can make in terms of this information, which is sitting in different chapters, or put it on a piece of paper so you can pretty much know that that will affect the pathogenesis. Now, what is pathogenesis? That's the important thing. How bacteria causes disease. That's what our interest is. There are two important things, as I said earlier. They have this ability to produce cholera toxin. That's number one. And then again, they have an ability to express a toxin co-regulated pili. So these are the two important things that we're going to discuss today. The other important thing is that there is a bacteriophage involved. We've been talking about different type of genetic transfers. So bacteriophage basically have a code for the two important genes, which are the subunits of the cholera toxin. So this is a cholera toxin. You can see A and B, right? So if you remember the transduction that we've been talking about in genetic transfers, so what happens is that this virus, which is of course a bacteriophage, it's going to bind to toxin-regulated pilus, and then that will allow it to move into the cell and become integrated into genome. So there are a lot of studies going on, and we want to make sure that the bacteria, especially Vibrio cholera, does not pass this information of releasing that toxin to the other. But again, there is a virus involved into that, which is going to integrate that into the genome of bacteria. Now, this particular bacteriophage, if you remember, there were two types of bacteriophages we discussed about. One of them was lysogenic, and the lysogenic bacteriophage basically also has some other virulence factors. So, why this bacteria is so virulent, and you want to control it, because it has a toxin inserted into the genome of the bacteria. Okay, and in this case, there are at least 3 important genes, and that's again a very common question asked: what are the 3 important genes for vibrio cholera? So number 1 is a accessory cholera enterotoxin, ACE gene. A for accessory cholera enterotoxin. The other one is a ZOT gene, zonula occludens toxin. Does anybody remember what is zona occludens? We discussed that in physio. What is zona occludens? Something in the back? They're supposed to know, or they're Googlers? Zona occludens is a SCAM. It's a cell adhesion molecule. Is a zipper. It's like a zipper. So it's going to put cells together. If you remember, we talked about that in detail in pathophysiology. And how does the zona occludens is one of those proteins, because if you open it up, it will allow the fluids and electrolytes to go out. So this has that gene, is going to open it up, right? So this is zona occludens, very important protein. And then we have chemotaxis protein. So these are 3 important genes which cause massive damage, especially in a strain which is 01 and 0139. And again, if you remember when we talked about the regulatory proteins, their expression is regulated by regulatory proteins. So this is important in terms of understanding pathogenesis of that. Now again, as we discussed earlier, that the AB toxin of cholera is functionally similar to heat-labeled enterotoxin of Escherichia coli. So that's the important thing. That's the most important thing that we need to do. And this is just a repeat information that when I talked about the AB toxin, I also told you that one is an adhesion part of the toxin, right? It's going to bind to the receptor. In this case, especially, I would want you to pay attention to that chapter when we talk about general pathogenic mechanisms of bacteria. There was one chart over there, and when I reviewed that chart, so I said, make sure that you remember these are particular protein expressed on the epithelial surfaces, and these are respective bacteria that go and latch onto those particular sites. In this case, you can see that ganglioside GM1 are the receptors, gangliosides GM receptors, which are present on intestinal epithelial cells, right? Some of the receptors like fibronectin binding or lactoferrin were there on the throat, the epithelial cells of the throat. And some of them are there on intestine, some of them are in the brain. So these are important in terms of attachment. And again, it's going to attach to the subunit and then internalize. And what will happen is that you will have hypersecretion of water and electrolytes. You basically will lose water and electrolytes. So you need to replace that. But why do you need to know the pathogenesis? Because antibiotics are not going to work, because it may have already released a toxin, and then toxin is going to go and bind. So we can either stop that binding over here so that we can prevent the loss of fluid and electrolytes. Because even if you compensate for that, it's just like, you turn the tap on, right, and it's running, and you're just replacing the water. It's not going to help. So you basically also have to make sure that you stop the binding of the toxin to epithelial cells. And again, as I said earlier, a lot of liters of fluid are lost. And with such tremendous loss of fluid, you would have thought that is going to flush out the bacteria, but bacteria are smart enough. So what they do is that they adhere to mucosal layer. So they adhere to the mucosal layer because they have a specific gene which is going to allow them to attach to that. And these are toxin coagulated pili and chemotaxis protein. So these are two TCP and CAP genes which will allow them to cause an infection. Whereas those strains which are non-adherent, they will not cause infection. So the idea for pathogenesis is that, like basic pathogenesis mechanism, any bacteria to cause disease have to adhere, penetrate, and then release whatever they need to release. So you would have thought, remember we talked about gonorrhea, for example, we talked on Neisseria. So I said that normally is going to be presented as urethritis, and you would have thought that urethra is flushed by urine at all times. But in this case, bacteria may have evolved a adhesion mechanism which will allow them to attach to the urethra and not be flushed out. So you would have thought that if you're having diarrhea, it will flush off bacteria. Well, it would do, some of them, but it has an ability to attach to the mucosal lining and then again cause problem. And this is coming from the particular pathogenic factor. So if I ask you what is the pathogenic factor that actually cause disease in Vibrio cholera, the answer is these are the two important TCP and CP genes which allow this bacteria a additional ability to attach to those mucosa. Okay, when you look at the clinical picture, what you normally see is all of a sudden you have watery diarrhea and vomiting. So you basically lose water from both ends, so to speak. And then again, you will have a very severe dehydration. And again, as you know, you've already done kidney physiology. If you lose that, what will happen is that you will have metabolic acidosis and hypokalemia and hypovolemic shock. So this patient would die. In that first picture I showed you, that woman was about to go, and she was through the hypovolemic shock because her face was pale. And then again, metabolic acidosis is also important in terms of how the kidney deals with that. They also present at gastroenteritis if there is a milder form or there are toxin negative strains that you see many times in this part of the world when people go or swim in those water bodies or some of the other places that they're exposed to that water. Now, if you look at a typical scenario, so you will see that people will take Vibrio cholera in large number. Remember, in some of the bacteria, as I said earlier, you just need few bacteria to cause disease. The infectious dose is low. In Vibrio cholera, infectious dose is high. So you have to consume a large number of bacteria to cause the problem. Okay? And once you do that, they are also sensitive to stomach acid. And but again, if you are taking antacids or you have other reasons to have low, high pH or low acidity, then again, they will pass up to the small intestine, and that's where they will cause the disease, and you will end up having massive loss of fluid electrolyte, and they will also produce toxins. So this is like a typical scenario. That's what we call orophycal route as well. So oral fecal route that bacteria is going to be passed out. When you look at the clinical picture, vomiting is very profuse. We call it, normally what happens is that if you remember the vomiting reflex as a part of central nervous system, what is the vomiting reflex as a part of central nervous system? Why are you saying like this? It's one of the most important CNS physiology. We spent at least 3 weeks on teaching you central nervous system, and vomiting happens to be a side effect of quite a few drugs, and you're going to use antiemetics. So what is the physiology of vomiting? Okay. So we have to teach again, right? Okay, all right. Raise your hands who want to be taught again. No? Only one, two. Okay. So anyway, there's a vomiting center in the brain. There's a vomiting center in the brain, right? And there's a vomiting reflex. So what normally happens is that many times you have an aura. You're like, I feel I'm going to throw up. So that kind of thing comes up, and then you throw up. Many times people have this vomiting reflex, and that's called nausea. That's very bad feeling. And sometimes people advise, okay, put a finger in your throat and get it out. So that will relieve that kind of reflex. But in this case particularly, it's an effortless vomiting comes out, right? And then again, a very profuse diarrhea. But the most important thing is you can see that death is within 12 to 24 hours. The typical presentation we call, if you have been to that ward, you kind of go into the ward, and because with this open kind of hole into the bed and big buckets of taking feces, you will kind of smell. We call it typical fishy odor. That's what we call a fishy odor. And you have rice water stool, very classical of this kind of bacillary dysentery. What is the difference between diarrhea and dysentery? Great. So dysentery has blood in the stool. That's the difference. You can see from here. And then again, rest of the symptoms are the same. What you may want to do is that we don't teach you over and over again. And the idea for like cardiovascular system is that you should know when there is a loss of fluid volume, what are the physiological consequences? What's going to happen to kidney? What's going to happen to lungs? What's going to happen to metabolic activity? So you pretty much, know the whole sequence. You don't have to kind of repeat over and over and over again, same physiology. Okay? So it's for your concept that you know what will happen if I tell you what is hypovolemic shock. So what are the consequences of a patient when it's going to go into loss of fluid? So you can have to anticipate that. So you can treat them accordingly. Okay, as I said earlier, is a pandemic. Pandemic means worldwide epidemics are there, especially in developing countries, usually serotype 01. And then again, in this part of the world, you will see that coast of the United States, marine environments, especially if those people who are fond of shellfish, they also have vibrio infections. And then again, organism multiply in water. And most of the time, as I said earlier, is a waterborne disease. But if you take that chitinous shellfish, you can also get it. A person to person is rare. The reason is, why is it rare? Because the infectious dose is high, right? And why the infectious dose is high? Because most of the organisms are killed by stomach acids, right? That's what I said, but you can help the bacteria by taking an antacid, so they can actually have a lower dose of causing infection. In some of the countries, cholera is present at all times. That's what we call, endogenous. There's already there at all times. So if you talk of epidemic, we talk of pandemic, we call endemic. So endemic, again, your basic statistics, that you will see that if you were to visit these areas, they are known to have cases of cholera at all times. So you can see Asia, Africa, Western Africa, and then other countries as well, and then some spots here and there. Okay, so I'm pretty sure that those people who travel to these areas have to make sure that they take bottled water or boiled water, and be prepared if something happens in terms of infections. The other problem that we normally see is that in those areas which there is endemic, this means a fixed, more or less like a fixed pattern incidence of diseases. Right? This means it's just like, if you take an exam, any exams, it's going to go by a bell curve. It's going to have like some of people having A, some of people D's and F's, and there are people in the center. So that's like normal distribution, right? So likewise, what happens is if there's an endemic, there is a normal rate of incidence at all times. But there can be epidemic on top of endemic, where all of a sudden, something comes up out of the blue. So then the countries have to report the outbreaks, right? So we can report outbreaks, but also important, and I've been telling, I think I did try to kind of pass this message to you with this, something we call imported diseases. Because like hundreds and hundreds of people are traveling every day. There's nothing you can do about that. They will carry their normal flora. They will carry whatever they get, their intestines. They could carry whatever they want to do. So there are always chances that people, and there's nothing you can do in terms of coming up with any rules and regulations for public safety, apart from some of the stuff. Okay. But in this case, you can see that European, though it's present all over here, but most of the imported outbreaks and are there in America, you can see from here. But how do we know that? How do we know that this particular cholera has been imported? Because of the type of the strain. Because of the type of strain. So if there is outbreak of O1 over here, O1 something, and it's reported to WHO. WHO has a dictionary for that, a library for that. And then you report over here, both of them report to WHO, they can match it. And remember I told you the multi-drug resistant TB, when the person in Atlanta traveled all the way to Greece. And then, so this is how that's important for us in terms of typing the bacteria. That's what we do, okay? What was the other bacteria I said? It's very commonly typed in this part of the world, and there always are infections in the United States. What was the other bacteria that I said? Sorry? I said if you open the news, you'll always find every year news that there's an outbreak of that bacteria.
E. coli.
E. coli. E. coli. We talked about a very specific strain of E. coli, and that because of the spinach, because of the poultry, because of the eggs. Very common. Okay. Now, again, you can see from the previous picture, for example, you can see from 2006 to 2008, and you keep look at the color in terms of reported as compared to the next year. So you can see that the reporting has kind of decreased. The idea is that one of the objectives of WHO is to make sure you provide sanitation, which is drinkable water to the world. But unfortunately, half the world population does not have drinkable water. And half the population of the world does not have. It's so interesting that if you go and read the statistics on that, if the whole world resources were taken as 100%, that includes everything, water, air, gas, food, you name it. 55% or more is just used by us here in the United States for a population of about 300 million. And the rest of the world has to share with whatever is left over. So you can imagine the discrepancy, or imagine the problems that we may have in terms of providing safe water, let alone forget antibiotics. So this is like a socio-economic issue that we have in terms. So there's going to be a lot of difference in you practicing in this part of the world as practicing and going back to your countries, for example. I remember some of my students were telling me they want to go back to Africa or Asia to practice. That's a challenge, but that's where it is required in terms of the problem that we have in terms of, let alone, drugs. We're talking about water, talking about food. Okay. Now, how do you diagnose? Of course, you must have figured it by now. We just diagnose it with the clinical picture. The whole family is coming. Everybody gets sick with diarrhea and vomiting. Of course, this has to be, cholera. But if you want to do a gram staining, you can do that. You can also do a culture, but again, of academic interest. And treatment, prevention, and control, the most important is replace the fluid loss, right? Antibiotics are given, and I usually ask this question, especially for cholera, why do you need to give an antibiotic over here when you know for sure that the toxin is there that is causing a problem? And the answer for that is to reduce the bacterial burden. So if you reduce the bacterial burden, less bacteria will produce the exotoxin. And then you want to cut out on duration of diarrhea. That's what we normally do. Of course, improved hygiene, not retrospectively, because once the person lands in the hospital, what is it that you're going to do? There is a vaccine, we call it whole cell or cholera toxin B subunit vaccine. But the problem, again, you can see it provides limited protection and herd immunity. I'm not going to ask you herd immunity, but I would expect you to know what is herd immunity. Okay, and those of you who have purchased the book and who also have online, access to the book, I think it does come with a online flashcards as well. So I think one of my students last year, they just added some of the important aspects in terms of the flashcards. So these flashcards are there as PDF on the website. And I know you guys are very smart and you always get a free PDF. And that poses a challenge for the bookstore. The bookstore in CSU is going to get closed because there's nobody comes and buys the book. Right? And well, she's asking, there is a big bookstore. Okay, that's very interesting. Okay, but the thing is this, that these are good because you can see, for example, a case study. You talk about that. And then again, trigger words are there: rice water, diarrhea, shellfish, AB toxin, and ganglioside, GM2 ganglioside. So these are some of the keywords which are there for you to help yourself, okay? And I don't know, everybody may have a different learning style, but there was a time when people used to make their own cards and kind of quiz each other and things of that nature. But it's always good for you to be aware at the end of the day, what is it there for me to know? What is it there for the professor to ask? These are the two questions in terms of your preparedness for a particular case. And you can see from here, some of the things like virulence factor, some of the diseases it causes, epidemiology, so on and so forth. So they're always good. And I myself have seen in advising people is that this best way to learn, again, will be to quiz each other, to quiz yourself. And there are quite a few questions available on the website as well, okay, for the book that you can go. And there has to be some mechanism where something should stick in your mind for good, okay? Because in this competitive environment, that's not a good thing for me to know that none of you is going to give me physiology of vomiting. That's not a good thing for me to know that. And I do see quite a few people who got A's over here, and they are looking at each other and other people. So this is something for your own interest. So make a little bit of objective in terms of setting standards for your own, okay? So because most of the professional schools, people are instructors. They will instruct you how to study. They're not teachers. It's not like, hey, you didn't teach me, what do you ask me? This is like a high school thing or maybe middle school thing. Was I supposed to read the book? Is there a bookstore? Things like that. So that's something that there's no way for us to gauge your learning. There's no way for me to, with best of all the assessment tool, I have to admit, we cannot possibly judge, but you need to take learning on your own control. So it's good for you. For microbiology, look at the cases. Cases sometimes brings you memory. I usually bring some of the impact slides. Just want to kind of impress upon you some of the things. You can quiz each other. And some of the students who came to me the other day, I told them about the recommended books as well. These are reviews for microimmunology, straightforward questions and straightforward answers. So don't put yourself into that stress that the exam tomorrow will be the first time that somebody has ever quizzed you. Or this is the first time you're looking at this question, right? So that's not a good idea for professional school. And you must have heard this from me over and over again. If you can recall that I was once, many years ago, called in to prepare for one of the, I would say, I don't remember, it was nursing, medical, some exam from Robert Morris University. So they have to come and pay me to prepare their students. So they gave me I would say 5,000 questions. And we spent 2 months on that because their goal was that their students have 100% pass rate. So for professional education, especially related to medical field, the best thing to prepare is before the lecture, during the lecture, immediately after the lecture. If you haven't done it, just before the exam, you cannot go back and read book. It's too late. Now you need to quiz yourself questions. This is learned by question. That's the nature of the beast, so to speak. Okay? So you have to study that. It's not like studying, but smart studying. So this is what's going to count. And if you are a little smart and pick out questions and some of the other questions which are available, and help yourself. Okay? So I think I did finish earlier to give a sermon on how to